Good afternoon, everybody. It's Dr. Galvin with Sunday's coronavirus update. It is an absolute beautiful day here in North Carolina. You guys can't tell, but I'm actually in shorts. Been working on rebuilding a staircase all afternoon, so if I'm a little bit gritty and grimy, I apologize. We're going to talk a little bit about Dr. Erickson and his press conference in California, because I've gotten probably 50 people who have sent me that and want my opinion. And we're going to talk about that. First, the numbers: 2.95 million cases worldwide, 205,000 deaths, 860,000 people have recovered. Here in the U.S., 981,000 cases, 55,000 deaths, 108,000 recoveries. Locally, 8,830 cases, and I think we're up to 250 death-wise. So what I really wanted to talk about was this press conference by these two urgent care doctors, ER doctors in California. They own a chain of urgent cares. And basically what they said is that we should be sheltering in place, that it's all nonsense, and their data proves it. And, you know, I can't say that I completely disagree with these guys. I think that their data, I haven't seen their data. This was a press conference. It hasn't been published, hasn't been peer-reviewed. But I think that their conclusions are a little bit suspect, and this is what I think. What they're saying is that in their urgent cares, they've done 5,273 tests for COVID, and they've had 340 positives, which is a 6.4% rate of positive. In California, they've done 294,000 tests, 34,000 positives, which is 12.4%. And they are taking that data and they're extrapolating it to the general population, and their logic goes like this: that they're saying there's 40 million people roughly in California, and if 12.4% of those people have the virus, then that equates to, and they've had 1,200 or so deaths. They said that equates to 4.7 million cases in California, 1,200 deaths. That's a 0.03% death rate. So your risk of dying from COVID is very, very, very low, 0.03%. And I think that if you do that math, it makes sense. But I think that there's a critical flaw in their thinking. And I'm not saying they're right, I'm not saying that they're wrong, but they are assuming that we're testing everybody, and that's not who we test. They're testing people who come to their urgent cares who are sick, who have symptoms. So, you know, what's the population of the country or the state of California at any one time that's actually sick and is going to go to the doctor? Well, it's a much lower percentage. And let's be generous. Let's just say that we're going to assume that in any one time, 5% of the population is sick enough to go to the doctors. Well, really, those numbers then have to be looked at in a little different way, because if we're just testing people who are sick, and they never, you know, they're not saying anywhere that they're testing, you know, they're not doing COVID testing on people who are healthy. We do antibody testing on people who are healthy, and we're starting to do that, but we don't test for the virus in people who are healthy. So in that case, those numbers change quite a bit. Then we go from having, you know, if it's 5% of the entire population, and I want to make sure I got my math right here, of 5% of the total, that's, you know, potentially in a state the size of California, that'd be around 2 million people who are sick who might get tested. And if you're now using that number, and you do, you know, if you look at that rate of 12%, now you've got, you know, 241,000 of those people who are sick are presumably going to have COVID. And if 1,200 or so of those die, that's actually a 0.5% mortality rate. Very different than 0.03. And that's the difference between, you know, potentially 11,000 deaths at 0.03% versus 200,000 deaths at 0.05%. And if you extrapolate that to the rest of the country, you can see that those are very different numbers. And so I think we have to be careful extrapolating COVID testing, which are only done on people who are sick, to say that that represents the rate of COVID in the entire population. Now, we've talked about these antibody tests, and we've had ranges of positive antibody tests from 4% in California to up to 20% in New York City. But again, those tests are a little bit suspect, and so I think we've got to take all of this with a grain of salt. Do I want to open up? Absolutely. If indeed the mortality rate is that low, should we open up? Absolutely. Can we extrapolate from that data? I think it's dangerous to do so without knowing more. And what do we keep talking about? Testing, testing, testing. We have to do both COVID testing for people who are sick, and we need to do antibody testing on the general population, good antibody testing, tests that have actually been validated to find out what the prevalence is. Only with that data can we make good decisions. The business about the masks, I have to disagree with them about that. We've talked about this from the very beginning. We're not wearing masks to prevent ourselves from getting the virus. We are wearing masks to prevent the spray of fomites out of our mouths if we happen to be sick. So masks are not to protect us, masks are to protect others. So, you don't have to wear a mask to go outside. You're not going to catch COVID, and I've told you guys that from the very beginning. The idea is you wear a mask to protect other people in case you may be in that asymptomatic 4 or 5 days before you develop symptoms. You're doing that to protect others. Do we still need to shelter in place? Until we have good data, I'm afraid to say no, we don't. Because if we get this wrong, many hundreds of thousands of people could die. We need good data, we need to test. And if we do that, and the data shows that we can relax restrictions, absolutely, we should do it. Now, again, I haven't looked at their data. I've listened to their entire hour-long press conference, and I think they're smart guys, and I'm not saying that they've got an agenda or anything else. But my big issue with what they're saying is that they are associating with positive COVID tests with the entire population. And they'll, I'm sure, agree if you were to ask them, who gets tested for COVID? Well, people that have these criteria. They've got a fever, they've got cough. We suspect that they've got COVID. You do not do a COVID test on somebody that went in to sprain their ankle, right? You don't suspect that person has COVID, so why would you test them? So I think that's the main difference. I'm going to cut it short today. Have a great Sunday. It is a stellar day here in North Carolina, just beautiful. I want you to, like I said, wash your hands, take care of yourselves, take care of your families, take care of everybody around you. Be safe. Have a great night. I'll talk to you tomorrow.